Okay, we have another case. This is actually a very good case. This case is very green. I know this doesn't look good. At first glance, pretty much everybody can kind of tell that right here he's got a fairly large infection on the front teeth, that they're wobbly, they're moving, and there's no back teeth. The fact is that he has a lot of bone. And the bone quality is good, the shape is good, and he can actually restore quite a bit that he's been limited to. Right now he's only limited to chewing right here. And that's not good for this system here. He's chewing against a very delicate 5-unit bridge that is on 2 root canal treated teeth. So that's not a good long-term solution. When we talk this case through, you're going to see that this is actually a fairly easy case because what the patient is presenting here is a lot of green marks across the board with the bone, the medical dental history, and the only question, and also there's no cosmetic concerns really because he's really looking at the lower teeth. He's not looking at upper teeth, which are the primary cosmetic concern for most people, is the smile, the lip line, etc., etc. So looking at his case, let's look a little bit more at where or what we could do with it. Right now, the vertical dimension is actually held pretty well. And what I mean by the vertical dimension is, here's his front teeth. He is in what we call a class 1 bite. And yes, it does look really kind of nasty, but this is not bad for a dimension where the gum and the bone are relative to where we have to occlude, meaning the position between the lower jaw and the upper jaw is a big problem if the patient has no teeth or has collapsed the bite and he doesn't have any back teeth to stop, but because he has that little premolar over on this one side, it allows him to have a stopping point so his muscles aren't used to being in a collapsed position. If you are in a collapsed position where you have a collapsed bite, your muscles contract more and get used to that position. So think of golf or some sport or anything that you have muscle memory that you just keep working over and over. You do that with your jaw muscles as well. And when you collapse the bite, I have to have room to put the prosthetic in. I have to have room for a bar. I have to have room for implants and a denture and pieces like that. If I don't have that room, it's very difficult to actually try to get the jaw to open up appropriately. So this is actually very good. I don't like the bone here. He's going to have a lot of gum recession here, but we can fix that on the prosthetic. But the fact is that he has the vital components to keep everything in check. Let's go back to the CT, and we're going to look at the bone quality. I'm going to go back here, back where the nerve is, and we're going to look at that here. When you look at the bone quality here, you'll see that there's not a lot of super dense bone and not a lot of very light, weak bone. And this is where we want to be. We want to be in this zone here, and this is beautiful. The fact is that he does have a constriction here, but the constriction ends up fairly low and it's right close to the nerve. So his nerve is right here. So his nerve position is pretty ideal. His ridge height is actually pretty ideal. And if we start putting in implants across the back teeth and the front teeth where we want them in an ideal position, we can see that the actual implant is in quite a bit of bone here, and good quality bone, and we're still far enough from the constriction point as well as the nerve. So those aren't a big concern because I just love that it's a good size implant as well as it's a good position across the arch for the occlusion as well as the high quality bone that he has. So this is why it's a green, and it's a really, really fun and good case to do. Here, when we look at where these implants are, we are a little bit concerned about the immediate placements of these implants. These are in fresh bone areas. They both are very good. Here's where we just have to look at how can we limit our chances of an immediate failure due to infection? And so with this case, these teeth will come out and we have enough bone to get the implants in and secure them in. But what I want to do here is load him up on as much antibacterial rinses, antibiotics before he comes in. So when he comes in, we're going to clean everything up here and we're going to rinse and aerate this because the bad bacteria that are in this area are anaerobic. So if we aerate the area before we really get into do surgery, the blood will bring oxygen to the bacteria as well as the antibiotics that we have on board, as well as the rinses that we have on board, as well as us irrigating and rinsing things away with saline. And that's a really, really nice case to kind of clean things up, put the implants in, get the teeth out, right, and give them a full lower denture here in this case. So I really like this case for a lot of good reasons, and you just heard it. The only concern I have him would be the vertical dimension because he doesn't have a bite, a solid bite. Down the road when we put the prosthetic in, I don't know how he chews. I don't know what his habits are. Does he grind side to side like a cow or does he grind forward to back like a rabbit? But that's an easier problem to fix with a fixed prosthetic or a prosthetic that's going to be anchored down on the implants. And that could be a different discussion. But before starting this case, this is a really great green case to start off with.